So we're looking at the next type of sterilization, and this is what is known as a Madlener. Okay, Madlener sterilization. Okay, sorry, I just want to. Somebody's trying to call me, and I just want to tell them that I'm busy. So this is a Madlener sterilization for females. So how is this type done? Okay, so we know that sterilization is sterilization, just that have different approach to it. So Madlener sterilization, you could actually see how it is done. Hemostat crushes the segment. Loop of ampullary portion of tube is elevated. Tubal segment is not removed surgically. Tubal ligation over crushed area. So just all about time. Okay. So it's a historical method. Once you start hearing historical, that's to tell you that it's not actively being in use again. So it was mostly used for permanent contraception, though it's rarely performed today. It's worth understanding, okay, because you should know that this actually gave back to newer procedures, right? So surgeons improved on this one to birth the new ones we are using. So it was developed in the early 20th century, crushing and ligating a loop of the fallopian tube with a suture. Okay, you crush it first, then you tie it. So the tube is not cut or removed; it's just tied up and sealed. The goal is to block the passage of eggs from the ovaries to the uterus. We'll get to look at why it looks promising, but why did they actually stop using it? So why it's rarely used? There was high failure rate. Okay, so other techniques were better than it, okay, in preventing pregnancy. No tissue removal. So because the fallopian tubes are only tied and not severed, there's a high risk of body re-establishing the continuity. So people also stopped using it because alternative methods came up and they were much more jiggy than this Madlener sterilization for females. Okay, so that's it for the Madlener, just so you know how it was done.